Hi everyone, and welcome to this panel hosted by War on Cancer. My name is Mona Esmailzadeh. I'm a medical doctor, neuroscientist, entrepreneur. And today I have the pleasure to be the moderator of this very important discussion. What about my mental health is the theme of our discussion today. Mental health is an often neglected area, especially for people affected by cancer. And of course, the main focus is to get the treatment. But although we all know about this problem, we know how wide this problem about mental health is for cancer patients. It hasn't been much talks about it, about the hard facts and figures. But what brings us here today is the great efforts that now have been done to quantify the magnitude of this problem. War on Cancer app has launched their third health study in the app themed Is Cancer Care Addressing Your Mental Health? 1,000 people under and after treatment took part in this study, with the majority coming from the UK, Sweden, and the US. And the goal and purpose with the study was to investigate cancer patients' perception and experience of how healthcare and society addresses the topic of mental health during and after cancer treatment. So in a minute, I will reveal some of the interesting key findings of the study. But before that, I would like to welcome our very interesting panel and guests here today, all representing different parts of cancer care. So first, our three guests that are with us digitally. Dr. Martin Inderbitsin. Martin, who himself was diagnosed with pancreatic cancer in 2012, has a quite interesting academic background. He's a mindset and self-leadership expert and has a PhD in neuroscience. So Martin is a brain scientist and has been studying stress and emotion and how they affect our behavior. And today he dedicates his time to understand how our mindset influences what we do, helping people to increase their self-leadership skills. Nice to have you here, Martin.
Hello, everybody. It's a pleasure to be here.
Our next guest is Dr. Jabba Diggy. Jabba is a director at International Psycho-Oncology Society and board member at European Cancer Organization. Since 2001, he has been working with cancer patients, professionals, and oncology institutions. And based on his experience, he has developed the first multi-center study on psychosocial aspects of cancer in Romania. Very interesting. Welcome.
Thank you so much.
Dr. Susanne Schaffert. Susanne is the president of Novartis Oncology and is pursuing a bold strategy to reimagine the research, development, and commercialization of innovative treatments that will help improve and extend the lives of people with cancer. Susanne oversees more than 10,000 associates in 85 countries working to transform cancer care and address some of society's most challenging healthcare issues through science-based innovation. Welcome, Susanne.
Thank you so much. Excited to be here.
So back to the studio where we have three other interesting guests. Elin Schuss. I met Elin some years ago at Barry's boot camp. And, well, she was this superwoman, superwoman exercise guru. And most probably, you're one of the physically strongest persons I've met, Elin. Elin was diagnosed with lung cancer in 2020 and is currently undergoing treatment. But what I love with you, Elin, and your story is that you have really continued to fight. And I just have to say, I rarely get impressed by people, but I really think you are that source of inspiration. And I'm following you on Instagram, and really, I admire your dedication and positive mindset. So welcome.
Thank you so much for those words, Mona.
Dr. Hans Hägglund. Hans is an experienced medical doctor and researcher skilled in clinical research within hematology, focusing on stem cell transplantation and mastocytosis. Currently, he holds the position as the National Cancer Coordinator at the Swedish Association of Local Authorities and Regions and is a project leader for Vision Zero Cancer. Welcome, Hans.
Thank you very much. It's an honor and pleasure being here. Thank you.
Thank you. And last but not least, Fabian Bolin. Fabian, I met you at the American Embassy a few years ago, where we both were invited to give our thoughts about the future of healthcare. So Fabian is the co-founder of War on Cancer app and was himself diagnosed with acute lymphoblastic leukemia in 2015 and has just recently been declared cancer-free.
Indeed.
Congratulations. And after being diagnosed at the age of 28, Fabian, you had to experience over 900 days of chemotherapy. And through the process, you realized that there is really a lack of understanding, not only in society, but also from healthcare, on what it is like to experience cancer from a mental health point of view. So having experienced this firsthand, you became determined to radically improve this area. So welcome, everyone.
Thank you.
Let's get to the key findings of the study. And this is a very short event, really. We would need to talk much more about it. So I hope that this is just going to be a short discussion and hopefully be, just the beginning of finding ways in a near future of how each one of us actually can improve the situation for everyone affected. So the first key findings is that more than 71% say that their mental health has declined since cancer diagnosis. And I mean, in a way, it's not very surprising, is it? It's really a trauma, and I would actually be surprised if it wasn't, this many people affected. But I think here we get it really black and white. So we have some figures to talk about. And this just confirms that mental health is an issue that should be addressed. Yeah. Elin, I'm thinking you have been through this quite recently. How was it really to get to know that you have cancer?
It's been like an emotional roller coaster for sure. And it's been a lot of downs and also a lot of ups. But in the beginning, it was just mental chaos, just a lot of fear, a lot of stress, not knowing, and also getting that diagnosed at an age of 32. I didn't know that much about cancer and about treatments, and it was a whole new world that opened up for me. So in the beginning, I didn't really want to accept that I had cancer. So I was living in denial at first, but after a while, I realized that it only made me sad, and it gave me anxiety, and
with all these feelings and emotions and chaotic mental situation that you were in, did you get referred to a therapist, or did you get any kind of guidance?
Yeah, I got a contact to a therapist, but I wasn't in the beginning. I was not in that state of mind. I didn't want to talk to a person that I didn't know. I didn't want to sit down and talk about things that made me sad and about fears and worries. I didn't want to do that.
Exactly. So did you talk to your family? I know you have a sister you're very close to.
Yeah, we're really close. So I talked to my family, but at the same time, I wanted everything to be normal. I wanted everybody around me to be happy and to talk about normal things. So in a way, I pushed it away. So it was a lot of crying on my own because I didn't want anyone else to carry that burden. So
Right.
in the beginning, I was not. I didn't want to talk about anything around my disease.
Fabian, you had a bit of a different experience. What was it like for you?
Yeah, I'm actually positively surprised that you referred a therapist back in when I was diagnosed in 2015. I wasn't offered more than a chance to speak to a counselor, which is a form of sort of mildly trained person that will deal with everything relating to social insurance, these type of questions, more practicalities. But throughout my sort of 2.5 years of cancer treatment, there's not a single doctor or nurse that ever asked me the question, "How do you feel?" So, I mean, that alone sparked sort of the vision for building the War on Cancer app. And in fact, as you said, it's such a roller coaster. In the very early days of the cancer diagnosis, I think many experience a bit of a shock, where you're not really receptible towards, therapy and these type of things. And at some point further down the line, when reality sinks in, you realize that, oh shit, I have cancer. That's when, for many people, that depression sets in as well, and you have this sort of inevitable drop in your mental health levels,
Right.
which is. And from that drop, which I felt maybe 3 to 4 months in, where I really felt depressed, it's been an ongoing sort of roller coaster, but in an upwards direction for me. But I would lie if I didn't say that cancer is still affecting me in ways, and I think that's sort of ultimately what happens. Cancer is a life-changing experience. It changes who you are, and you're never going to go back to the person you were before you were diagnosed. So, in a way,
Yeah,
I'm
I've
still
also
dealing
heard
with.
that a lot from people who kind of, when they get back, it's like the same with people being in prison or whatever kind of, life-changing event. It's kind of hard to get back, right? So you need to, maybe it's not as drastic because you still live this life, but I think there are so many things going on that other people around you don't really understand. Jabba, do you think that mental health has become more prioritized, prioritized part of cancer treatment, or what's your take on mental health and cancer care?
Well, certainly there is a positive perspective in this regard that mental health needs are, more and more met. But if I may say, for example, in Romania, less than 5% of cancer patients have any kind of access to psychosocial services. And certainly, we need to accept better that mental health and all these psychosocial needs are not the other side. Many times we hear, well, you just have to get through it and be a survivor and be positive, and you will fight cancer and you will be fine. Well, actually, the psychological part shouldn't be the other side. It should be the same side. I mean, the human side. Cancer is a wholesome experience. It's not really divided between something that is happening in your body or something that is happening with your mind and your mental well-being.
Exactly,
So,
and we all know how your mental well-being, and also, for example, feeling alone or isolated and all these things, we actually know that also physically affects you, right? To a quite measurable extent. So there are, of course, many studies on how different parameters, such as cardiovascular events or like early mortality.
yes, and also all the immune system, and
Exactly.
yes, our psychological functioning and our psychological well-being. It's impacting everything, including our decisions that we take regarding our treatments and regarding our communication as well. And of course, quality of life, which is certainly important from the start of the cancer journey till, the survivorship planning and, transitioning into work and transitioning into a new life. Yeah.
Right. And I think that maybe that's why also, if we come to our second finding, that according to this study, 86% say that they think that all people diagnosed with cancer should actually get referred to therapy. And when you ask them the main reasons why, they say the five main reasons is because of feeling overwhelmed, feeling alone, lost identity, fear for life, and feeling helpless, just as Elin and Fabian just touched upon. So, Hans, why is it not a part of the routine procedure that everyone affected by cancer gets referred to a therapist?
Well, I think we have since a long time been very focused on survival. It's easy to follow. You can see either you are dead or alive. And if you look into a diagnosis as acute lymphatic leukemia, we know that in the 70s, only a few % of the kids survived. But now today, there's more than 90% that survives. It's easy to measure. So the focus has been on survival.
Exactly.
And the mental health has not been in focus as you mentioned, Fabian. But I was also glad when you said I was actually referred, and I think it has been a change. At least in Sweden, there are national guidelines today with it called rehabilitation care, and those guidelines actually cover the mental health situation, and hopefully this will it will be more focused now, because more patients survive, and now we have to switch focus to or also have focus on mental health. So.
And I mean, I think that partly it's of course a financial question, of course, but I think that more than that, it's a matter of knowledge, right? I think that many people are actually not that aware of how integrated this is in the whole cancer patient situation. And so in this study, 50% replied that they also were not given any kind of information or clue about how to manage their life after cancer. So this thing that has become, a great part of your life and unfortunately a great part of your identity, I guess, suddenly is no longer the main focus when you're back. And, you need to get back on track to your normal life and refine your identity, I guess. And there are so many aspects of it with solitude or whatever kind of, both Fabian and Elin, I think, also are very social people who already have, from the beginning, a very rich social network. But I'm thinking also about people who maybe didn't have that much of a social life from the beginning. I guess that's going to affect them quite radically. So, Hans, who is actually responsible to make sure that we are fully aware of how to deal with this kind of trauma after a cancer treatment?
Well, legally, it's at least in Sweden, it's clear. It's the healthcare sector, and when it comes to cancer treatment, it's a multidisciplinary organization around the care, and I think, it's the different clinics that are responsible, and it's still rather divided. It could be in surgery, it could be oncology, and it's each head of the clinic that are responsible. So that's clear. But I would say that the question that was asked here, how is your mental health, should be asked frequently. And if you ask that question early on when you are diagnosed and continue to ask the question, I think that you can pick up those issues and also refer the patient to right care. And then you also, then the patient knows when they leave the hospital and are outside, that they have to ask the question to themselves.
And I mean, this is a quite delicate question, right? As Elin mentions, I mean, at first you maybe you get even intimidated that someone is asking about your mental health because, you know, you have this life-threatening diagnosis, and why would you, you know, who are you to ask me? You know, so I mean, but I guess that for me it seems like there should be a whole kind of education when it comes to this very particular thing, because you have so many aspects of it. You're dealing with life and death, and with normal people who can be anyone, you know, who has a career, or a superwoman like Elin who's been exercising her whole life, and you know, there are so many layers to cover. But I think so, and it seems to me that, but there should, as you say, it would be wonderful to have this frequent, you know, where you touch base and can get into people's mental health. So Martin, I'm a little bit excited to know, as a fellow neuroscientist, and you know, what actually happens neurobiologically when a person experiences a trauma like this?
I think when we have to talk about trauma, we have to differentiate between the traumatic event and what happens with this experience after. And in the traumatic event, we can say it unfolds in 4 steps. Like as Elaine was saying, like a diagnose, some stressful stimuli is the first step that is just like overwhelming in all senses. So what happens to your brain is, you have to imagine our brain is very fine attuned to detect danger in the world. And especially the part that is very old in our brain, not the newer part, the cortex, but like the subcortical part responds to that. So what happens, you just get flooded with cortisol, with adrenaline, with neurotransmitter, like your whole system is just like showered with all this kind of hormones. And so what happens then is you experience a physiological change. You get like a heartbeat goes up, you get like diluted pupils, the blood flow increases. So you have this cascade that is like happening through this stressful stimuli. Now, how do people respond to that? There are different types of responses. You probably know the fight or flight trigger. And this is probably also the reason why patients don't want to have like a therapist at the beginning, because they are like so ready to just go and fight. They are not like ready yet to just open up. And that's totally normal. And another response that we see is just like freeze. We get numb, we get overwhelmed, like the whole energy gets out of our system. So this is the traumatic event, which in itself is not a problem. The problem is that we store it in our system. So we accumulate all these triggers, these memories that are repeatedly triggered during our cancer journey, which always like gets our system up to 120% again. And that's where the problem comes in.
Exactly. Thank you very much, Martin. And I think it's quite interesting to think that, you know, with all kinds of trauma, in a way, we talk a lot about, you know, post-traumatic stress disorder and all these things. But I think that you can also clearly see that people who have been through a trauma like this, and when they come out on the other side, you know, I usually say that trauma can give you superpowers. So once you have overcome the worst part of the trauma, you can actually talk about something that they have done some research on called post-traumatic growth, which I really think is interesting. So anyway, I'm going to keep myself to the discussion, but I really think there are so many interesting aspects of this. And Suzanne, I'm really interested to know, I mean, considering that there is so much emotional impact going on in cancer, and, you know, through the cancer patient journey. What role does the pharmaceutical industry play, and also what can be done? I mean, are there any regulations that makes it difficult for you to, for example, interact directly with your consumers, actually?
Yeah, I think, Mona, it's a great question. And I mean, I refer to also what Hans has said. Our role is to develop treatments for people that suffer from cancer. And the focus in the last decades was survival, was outcome. The focus is that we want to stop this cancer cells to grow. But I think what we learn more and more, it is not only to add years to life, but it is also to add life to those years. It's so critical that we also think about the mental health and that there is positivity, optimism. So what we try to do is, of course, we still follow science, and we try to understand how can we stop this cancer to further grow and impact health. But we also need to understand, when we then have a treatment and try to develop that, what do patients really need? And that's exactly to your point, Mona, that we try to really hear the patient voice, and we try to understand what is really needed, because sometimes we completely underestimate what is important in such a situation. And we scientists have maybe a completely different view than someone who is really impacted. So we work with patient associations. We really try to involve people from these associations that guide us and tell us what is important. For example, is it more important to have a daily pill or an injection? How long do you want to take this treatment? What side effects are acceptable? And of course, we cannot do miracles. Some side effects might still be there. And therefore, for me, a second role of the industry is to provide more education. And really, we do a lot of education for physicians. And I think this aspect of mental health and well-being and how patients can cope with side effects that unfortunately are not avoidable is so critical.
Absolutely. So, and I think what you say, Suzanne, is also that kind of, lights something up in me, is that you're absolutely right. In a way, we could say that we have been doing such a great work, within science, that we can actually we have treatments today for things that were impossible just a decade ago, and now we have the luxury of talking about mental health care, right? In a way. So, but do you think that is the regulation set so that you can, because when you had that focus on, survival estimations or figures, if we now switch focus, do we have the right regulations so that you actually can have the optimal interaction with patients? Like Elin, for example, how do you really tap into her mind? Do you think the system has to change in a way, the regulations that are, or do you think that they're good as they are?
I think certainly a direct dialogue would be much easier, but we respect in a way what the regulations are. And that's why for us, patient associations, groups that represent patients, and like many we have here on this panel have been affected with cancer. These are great consultants for us to really share what is important, what should we consider. So I think it is no excuse that we foster the dialogue and that we work together, and we should not get distracted by regulations, but really look how we can do the best.
Exactly. So, if you could just dream the utopia of cancer care, what would it look like from a patient perspective? What do you say, Elin?
That's a big question. But I think that, they offered me to see a therapist in an early state, but I wasn't ready. So maybe my hope and dream is to ask in the beginning, but also follow up. And maybe, you get scheduled for scans or doctor's appointment, but maybe they could get an appointment to actually you get a letter home and you
exactly, or you have an open communication, because it's just like Martin was also saying. I mean, this is like a grief process, right? Like psychological. So it's interesting. You need to, of course, not be in denial when you're asked.
Exactly, and actually, I started working. I think it took about 6 months, and then I started going to a life coach, and that changed everything.
Wow. You went to someone like Martin.
Exactly. I went to someone who gave me tools and guidelines how to think, how to deal with my emotions, and that changed my whole mindset.
Fabian.
Well, I think it starts with, in essence, the main person or the main institution responsible for patients is the healthcare institutions. So I think it starts with them. I mean, today, when I was diagnosed, and I think when you were diagnosed, it's still the same. It's like, hi, you have this cancer diagnosis, here's your cancer treatment, and then zipped, nothing more. What I wish it would have been instead, it was more a proactive treatment plan for your mental health, saying like, hi, you have lung cancer, here's your treatment plan. Also, throughout this journey, it's really important we work with your mental health. We're going to track this and monitor this, and throughout the journey, we'll provide you with self and coping mechanisms.
Right.
I think that is where we need to start. And if you really look into, we've been working with for a long time now with mental health and cancer, and mental health is quite a complex sort of element, because it revolves much more than just within the walls of healthcare. It's the whole life, depending on my personal kind of psychological mapping, you would say, my circumstances, my financial situation, family situation, all of these things together make up for a different package that will then affect my mental health differently. So I think it's also important to understand that we need to, I guess, redefine health, and healthcare institutions specifically need to look at health from a more ecosystem point of view, where they see that, we are a part of a much larger ecosystem involving, career advisors, financial advisors, gym sessions, meditation apps, social apps such as War on Cancer, for instance. And that is sort of why we built that tool and our app, in order to play a part. We're not saying that we're going to take care of the whole mental health situation. We're playing a part in a larger ecosystem called health for cancer patients. That's where I would love to see this conversation going, because I think that's the solution for 2030 healthcare.
And you also mention here families and the family situation. And actually, my last key finding from the study that I'm going to mention here is that 68% say that loved ones are the forgotten ones. What can be done to improve this situation for the families of the patients? Elin?
It's the same thing that Fabian is talking about, but also in an early stage, helping them with maybe seeing a therapist or getting them tools to how to deal with it. Because that was a big stress for me, seeing my family suffer, seeing them sad. That only made me more sad.
Of course.
So they were trying to hold it together in front of me, but I knew that they were suffering, and I would have wished that they got offered help early for me as well. I think that could have changed it for everybody, because everybody is affected by cancer.
Exactly.
The family.
Well, there are so much more to talk about here, and we will soon round up this panel. So I just want to thank you all for joining this discussion, and I hope that we will continue this discussion outside of the studio, and that it hopefully leads to some measures that actually can improve the lives of those affected. So before finishing, being a fact-based optimist, I always like to, look forward, let's say in a near future. So when it comes to cancer care, 2030, what can we expect? So if each of you would just pick one thing that you would like to do to push for change for the better, what would it be? Hans?
So, since I'm one of the founders of Zero Vision Cancer, I really believe in that we can reach 100% survival. And to reach that, we need to collaborate within the healthcare, researchers, industry. And I think now we should focus very much on precision medicine, because if we could target the tumor, we don't cause that many side effects, and then we can focus much more on the other sides, like mental health.
Right. Martin?
Well, I would envision an approach to help people treat mental health which is destigmatized and somehow more cool. Not that we patients are always the victims and the poor ones. And to do that, I think patients in 2030, they will get an education about, okay, what is actually going on with my mind and with my psychology? Like understanding that you as a patient, you are not your brain. Like trauma is not a conscious choice. It's just like a response of your brain, and like learning to understand what's going on in your brain and how to deal with that. I think that will become an integral part of the future cancer care, or at least I hope that it will be.
Yeah, I think that's a very important point, really, to destigmatize from society's point of view. Suzanne?
Yeah, as I said, my dream is to really find cures for cancer. That's why I dedicated my career to this. And I hope in 2030 we come a big step closer to this dream. But I think for me, it's also important that we see people affected as the human beings they are in their life, they are living, and that we make sure that they can just be, you know, as they were before, that as Martin said, there is no stigma, that, you know, that they can just live their normal life. And that's my big vision, my big dream. And that's why I will not rest until we get there.
Thank you very much. Jabba?
Yeah, let me say that my dream is that, you know, in 10 years, we will not have mental health issues and challenges in cancer care as a kind of luxury or sometimes as a kind of luck, but we will have it like an essential part. And I certainly will like to join you, Fabian, because I believe that health should be, you know, our concept and our way of dealing with health in cancer care should be redefined and should be broad enough as to cover all these issues and all these needs that are in the psychosocial part of this cancer journey. So, and let me remind you that access to healthcare, including mental health care in cancer, is also a human right. So I strongly believe in this, and I dream that it is going to be essential, integrated, and broad enough for all the experience that we have in cancer.
Thank you very much. Elin?
Yeah, I agree with everything they said, but also more focus on mental health, and also a lot about not being a victim by getting cancer. It's just the mental health is just going to be a part of the healing journey along with the therapy you're getting. So
I love that, not being a victim. And, you know, that's why I love following you, because I can really say, you know, I love Rocky. He says it's not about how many hits you give, but, you know, how many times. It's not about how many times you hit, but it's about how many times you get hit and still you stand up and you continue forward. Yeah. Fabian?
Well, I pledge to continue to work building the War on Cancer app better for people affected by cancer, and continue to work towards creating or facilitating or enabling, I would say, this ecosystem. I think it's still the conversation, especially with healthcare, often kind of leads towards the therapy as the only solution. And I mean, just look at the number of people affected by cancer in Sweden every year. It's like 65,000 patients. And then, you know, you have another 65,000 at least loved ones. So that's 130,000 people. And let's say they need therapy on a 2-weekly basis or once a month. You know, there's not enough therapists to go around to cater to those needs. So that's why I really want to look at, I wish that we could look at especially mental health or just health from a much more helicopter point of view, and see where, how much do the healthcare do, and where do they invite partners, other type of solutions that could help and alleviate their work in order to create a better world, and a much more patient-centric care. So I just pledge to continue to, working my ass off to get that, make that happen.
That's great. I think we all need to do what humans are best at, being creative and just pushing forward for the better. Yeah. So thank you everyone for following our conversation. The full report from the War on Cancer app health study can be found and read on waroncancer.com. Don't forget to download the War on Cancer app if you or anyone you know would like to connect with others that can relate to experiencing cancer, or if you want to help out and push for change by participating in future health studies. I'm Dr. Mona, and it's been a pleasure to moderate this very important conversation. Take care and have a nice day.